let's pick up from where we have left. So the students have completed on the relevant history. So now we are moving on to the second objective, which is description of relevant examination findings leading to a diagnosis. So the trigger is saying that a nasal endoscopy was performed and the student is asked to choose from the combination below the salient findings seen in the image below. What I wanted to do in this question is basically to try and emulate uh, the nasal endoscopy findings that the student will be able to see, leading to a particular diagnosis. So, for example, if the student is thinking about nasopharyngeal carcinoma, so the scope findings should show features of a malignant, angry-looking mass, probably with some ulceration. Yeah? Allergic rhinitis, maybe the inferior turbinate is hypertrophied, things like that. So that this helps the students to understand that these are the salient findings that is expected in each of the diagnosis. So it will help the student to understand the disease as well as help the student with some of the more the assessment that the student will undergo. For example, at the end of year 4, they will go through the unmanned OSCE where we'll show clinical pictures and they are supposed to describe these clinical pictures. So, for example, presence of a lobulated erythematous mass. So the student can guess, okay, the lobulated erythematous mass would most likely be this one here, and the student needs to choose whether is it normal, is it seen at the right nasopharynx, are we showing the right nasopharynx, is occluded by the presence of this mass. So in this instance is seen at the right nasopharynx. The inferior turbinate, is it normal, is it occluded by the presence of the mass, or is it seen at the right nasopharynx? So this is an kind of a matching question. So the right nasal cavity is occluded by the presence of this mass. So it makes it easier for the student since this is an uncommon diagnosis. So I wanted to make it easy for the salient findings so that the students is able to appreciate. So the student clicks submit and there will be a prompt to say, yep, see the response is presence of a lobulated erythematous mass seen at the nasopharynx. So the student know that what they answered is correct. So after getting the correct salient findings in the nasal endoscopy examination, so the student clicks continue and the next question will be on the diagnosis. So now you can see here that the scenario is building up from the information that is given in the earlier questions. For example, this scenario would say that the patient complaining of nasal obstruction and epistaxis, and further history revealed that the epistaxis is from the right nostril and has been going on for 3 months now, associated with ipsilateral rhinorrhea and snoring. So, what is your provisional diagnosis? So, the student would give an answer here. For example, if the student answers nasopharyngeal carcinoma, which is not the correct diagnosis, click submit. The prompt will say you have 2 more attempts remaining. So the response is that is the wrong answer and the student will try again. So what could be the correct answer? The student may answer allergic rhinitis, which is also a wrong answer, and the student will get a prompt again saying that this is not the correct answer. So we need to reattempt this until the student get the correct answer. If the student doesn't get the correct answer, the student will, after 3 attempts, only the student can move on to the subsequent phase. So this presents a challenge to the student, a diagnostic challenge to the student to arrive a to the correct diagnosis. So in this case, the diagnosis is juvenile angiofibroma because of the typical finding and typical history. Yeah? So now that the student has given a correct diagnosis, the student is now being brought to the next phase of the lesson, which is the investigation.